Good evening to all the viewers who are watching live and will be watching on a recorded version. This is me, Orko Mukherjee, your IT manager. Just a quick synopsis. We will be starting the quiz part later on this month or on the next month due to some technical sag and some other difficulties in the team. So we are just waiting for some things to sort out. Then after that, we will start the quiz part, and from then on, you can just play the quiz and just come. If you win a chance, then you can come on the backstage. So without wasting any more time, let's just start our today's CMA with a 30 seconds countdown time.
Good evening.
Good evening, sir,
Good evening.
and good evening, all viewers. Slowly but steadily, now we are on 79th CME and crawling towards 80th. And it's a great part on the behalf of any alumni association. Today, one of the oldest colleges in the homeopathic school in West Bengal is conducting their alumni meet, DND Homeopathic Medical College. So they had also been very proud that NIH Alumni Association is doing this. And so, with your permission, please let us call on tonight's inaugurator, Mr. Dr. Rupak Biswas. Dr. Rupak has been from third batch of UG, BHMS in National Institute of Homeopathy and done his MD Homeopathy. And he has been a yoga passionate from his childhood and a qualified yoga judge, yoga trainer. And he had served our National Institute of Homeopathy for several years before joining in Government of West Bengal job. Over to you, Dr. Rupak Biswas.
Good evening, everybody. My regards to our respected Sir Dr. Narayan Kalyani, President of NIH Alumni Association, and Dr. Bidyut Mukherjee, Secretary of NIH Alumni Association. Myself, Dr. Rupak Biswas, alumni and ex-employee in Yoga and Physiotherapy Unit of NIH from 2003 to 2013. I am very much glad to get the opportunity to be the inaugurator for today's 79th online CME session. Today's topic is awareness and prevention of type 2 diabetes mellitus. Nowadays, type 2 diabetes mellitus is very common in our society. Type 2 or non-insulin dependent diabetes mellitus often occurs in the people who are over 40 years and overweight. Since it occurs in the later stage in life, it is termed as maturity onset diabetes. Type 2 diabetes mellitus can be controlled by awareness and changing our lifestyle, which will be discussed today by our speaker. We are proud to have Dr. Ashok Rai as a moderator. He is a professor and HOD, Department of Case Taking and Repertory, Kharagpur Homeopathic Medical College and Hospital. He is very close to me and very popular for his friendly attitude with students, junior and friends. His loud and sweet voice always makes a difference. Today we have a very eminent speaker, Dr. Lakshmi Gandhi. She is a homeopathic medical officer, former Registrar, Council of Homeopathic Medicine, West Bengal. She is the president of Lions Club of Asansol East. She was appointed as the Ayush District Nodal Officer of Paschim Bardhaman for leading the team of COVID warrior. I am handing over the mic to Dr. Ashok Rai.
I guess Ashok sir is unable to hear us. Maybe. Can you just, sir? Sorry to interrupt. Can you just make him understand for some reason to bring out his headphones? I mean, I think there is some issues with his headphones, if possible. Since Ashok sir is not with us, I'm just handing over to our host.
Once,
Please guide through.
once Bidyut, then we can start the speech and we can wait for Ashok.
Hello.
Hello.
Hello, Arko.
Better we can start.
Ashok sir is facing some technical snag. Let us call on Dr. Lakshmi Gandhi to start her session.
तुम्हारे हेडफोन का कोनो प्रॉब्लम कुछ लेके ना
Once, as soon as Ashok sir joins, we will be bringing him on screen. Over to you, Lokidi.
Good evening, doctors and my colleagues. Today we have to discuss about the diabetes type 2, its awareness and its prevention. As we know, the diabetes mellitus is nowadays, it's a burning questions and burdening the human race because of its complication and it's progressively increasing the glucose level in our body. So now we have to discuss what is diabetes. This is a metabolic disorder and is due to this reason the glucose level is gradually steadily increasing in our body level and manifested by group of sign symptoms, and if untreated or ignored, then it will lead to some complications which leads to fatal. That is why nowadays this burdening disease is very much problematic in our world, and that is why the WHO is now very much anxious about this diabetes mellitus. Now, the diabetes, this term actually comes from the Ayurvedic system of medicine, 1550 BC, before Christ. The Dr. Ibras Papyrus, he discovered that sweetest test of the urine of a diabetic patient and he named it Madhumeha. And this name is still continuing in the Ayurvedic system of medicine because he was the Ayurvedic physician. Now, after that, on 2nd century, the Areteus of Cappadocia, this doctor named this disease the diabetes, and after several years Thomas Wills added the mellitus due to the sweetest taste. But in our country at 1948 Dr. Vishwanathan started the awareness and the diabetic patient along with the government of India. As because its complication is very, very fatal and very, very complicated, that is why the world is very anxious about this diabetes. Now, we have to we must see the statistics throughout the world. Now it is throughout the world, 422 millions are the patient diagnosed as a diabetic, and 1.5 millions dying every year throughout the world. So government is trying all over the world to reduce the suffering from diabetes. In our country, the our country India is the second position in case of diabetic as a diabetic country, and the first country which has more diabetes patient is found, that is the China. Now China has 141 million patient in case of in diabetic, and in our country it is 77 millions, and third position is the Pakistan. If we'll ignore or don't try to treat or prevent, then within the 2050, these diabetic mellitus all over the world kill the human races more than 1.5 millions. That is why we must try to get rid of from this diabetes. Now, uh, as these statistics are so high, so we have to conscious about this diabetes. Actually, what happened in case of diabetes? Let us try to explain the pathophysiology of the diabetes. It is it will increasing the glucose level in our body, in our bloodstream. So if we measure the glucose level, then it will increase. So we have to know the normal level of our glucose. For knowing the normal level of our glucose, we have to know the 3 or 4 terms. We should remember all these things. That is one of the fasting blood sugar level, 10 to 12 hours after the last night supper or dinner. If we measure our glucose level, then it must be 80 to 100 milligram per deciliter. But nowadays, according to the American Diabetes Association, it is 70 to 100. But still now we are thinking about the 80 to 100 milligram per milligram per DL. So if the person has this type of blood sugar level, then it's okay, no problem. He is not non-diabetic. But if it is increased more than 100, but 100 to 125, then we have to call him pre-diabetic patient. Pre-diabetic. In case of this pre-diabetic, we have to measure their blood after 3 months, and if you will try to get rid of from this pre-diabetic to normal state, and he again can be reverse is healthy state, he can do it. If he will try, if he will change his mode of living, his food habit, some yoga meditation, like that. I will come about this matter later on. Now the pre-diabetic state, that is and in case of PP or postprandial, it is 140 milligram per DL of blood. One thing is there, nowadays another term, random blood sugar. It is as per the American Diabetic Association, it is 200, when you can measure anytime at the blood sugar, 200 milligram per 100 per DL of our blood. So we know the normal level, but when this normal level exceeding in our blood, so we have to call it diabetes. Now, what happened in case of diabetic mellitus in our body? That is the pathophysiology of this. Of course, the normal level is going upward. So the food we eat is containing carbohydrate, protein, fat. Of course, mineral, water, and vitamins are there. But carbohydrate in our mouth, the salivary enzyme amylase breaks into the monosaccharides or glucose, the simplest form of the carbohydrate. And we blood absorb these monosaccharide or glucose from the liver or the intestine, and it will reach at each and every cell of our tissue of our body organs. In presence of insulin, the hormone which is secreted from the beta cell of the islets of Langerhans present at the tail end of the pancreas, oxygen oxidize this glucose into the energy, and our cell gets energy. That is the glucose enter into the Krebs cycle. That is the normal phenomena. But in case of diabetes, we know, the insulin, or either it is not secreted, or it is secreted but insufficiently, inadequately, or it's secreted but it has some obstacle on its way to work. There may be whatever may be the cause, but insulin is not sensitize the glucose for enter into the Krebs cycle and to release the energy, and our cell is not getting the ATP. That is why the glucose level is increasing. If it will increase more than 180 milligram per 100 of DL per 180 milligram per DL in our blood, at that time kidney will excrete the extra glucose through the urine. That situation is known as the glycosuria. So kidney's threshold value exceeded. That is why that is 180 milligram per DL. We have to call it glycosuria. That is also the diabetic condition, one of the diabetic condition. Now, if we not treated, not care about this situation, then it will leads to damage of the kidney and leads to the complication of the diabetes. This is the more grievous condition in case of diabetes. So here another term is coming. The when the glucose is present at the cell due to absence of insulin, not oxidized or improperly oxidized, glucose level is increasing. Here is a one term is coming, that is the HbA1c. When we are examining the blood sample of a diabetic patient, it is the confirmatory diagnosis, establish the diabetic patient. This test, that is glycated hemoglobin or HbA1c. Because if we'll at that time test the glucose level, HbA1c, then it will not in normal level, more than 6.5 percentage present in our body. American Diabetic Association told that if it is 9 to 10%, then only you can use the insulin, otherwise only the medication is necessary. But if we know that it is within the normal level, that is 5.4 to 6.5, we can reverse this diabetic condition. So these will confirm the patient as a diabetic, because the lifespan of the RBC is 120 days, as we know. So that person is suffering from diabetes from last 3 to 4 months, due to, because we know the lifespan of the RBC is 120 days, and we'll get this glucose jacket around the RBC due to absence of insulin, which is not digested, and not getting the we are not getting the ATP. So these are the main pathology, and it will causing the damage of the Bowman capsule due to increased osmolality. Along with the glucose, some sodium, magnesium, other minerals are also excreted through the urine. So when the glucose level is increasing, but cell is not getting the ATP, cell is not getting the ATP due to absence of insulin. Oxygen is there, but insulin is not present at that time. That is why the glucose is not entering into the Krebs cycle, not getting the ATP. Cell is not getting the ATP. At that time, the feedback mechanism of our body, again due to crisis of the ATP, it will release the glycogen from the depot. Glycogen, the stored carbohydrate present in our body, it will mobilize and increasing the glucose level. That is the glycogenesis occur. More and more carbohydrate, the phenomena is same, scenario is the same. Glucose is carried by the RBC or blood and enter into the cell, but not getting the insulin and not releasing the ATP. So glucose level again increases. This is the other phenomena. It will also increase our blood sugar level. Again, the feedback mechanism will release the fat from the adipose tissue, fat depot. That 40% of the fat mobilized into the glucose. The scenario is same. So the glucose will also increase the glucose, fat will also increasing the glucose level in our body. Along with this glucose, the fat mobilized into fatty acid, glycerol, and other fatty derivatives that will joined with the co-acetylene enzyme and form the ketoacidosis. That is why, in front of if diabetic patient who are complicated will get the ketone smell from their breathing and from their respiration, etc. Later on, it will lead to ketoacidosis and coma and ultimately fatal. This is up to fact. Then again, one of the component of our food is remaining, that is the protein. This protein, it will also break down due to the feedback mechanism. It will also excited and it will again break down into the glucose. And this protein, so the from the muscle is breakdown, myotin, actin, all these protein are breakdown in to form the glucose. And the patient become emaciated due to loss of muscle protein. Gradually, that patient is emaciated. But glucose level is increasing, but cell is not getting the ATP due to absence of insulin. So the the glucose level is increasing. It will leads to several complications, starting from the kidney, eye, that is the retina, nephropathy, neuropathy, as well as the ulcer leading to gangrene, coma, diabetic acidosis. Several complications started within our body. So we must get rid of this diabetes if we'll change our food habit, our lifestyle. Now, let us discuss about the what type of diabetes we are getting in our world. Type 1, that we know that it is the insulin dependent diabetes, which is not curable, not reversible, and will get the patient since their young age, even from childhood will get the diabetic child. It is due to some genetic anomaly. And diabetic type 2, which is our discussing topic today. Except this, there are some other type of diabetes, that's a gestational diabetes. Few women are experiences the diabetic condition during their pregnancy, and it will soon after delivery she will be all right, but till some patient are continuing the diabetes in case of after delivery also. That is the gestational diabetes. Another type of diabetes is there that is secondary to others. If we'll get the acromegaly, or the patient suffering from cancer taking the anti-cancerous medicine, or the Cushing syndrome, several other congenital problems. So along with this disease, secondary is the diabetic mellitus that are not curable. So we are not thinking about this. Those diabetes we can cure, only we are aware about this, because it is preventable by the change of our lifestyle and our mode of living. So nowadays after research, scientists are getting another two type of diabetes also. That is diabetes type 7. This is also called MODY, M-O-D-Y, MODY type of diabetes, very rare form of diabetes, and this is monogenic also. Uh, Due to incomplete penetration or impaired glucose metabolism, this is occurred. But we didn't get the full picture due to research is going on till now. That is why later on we can discuss about this matter. And another type 3C diabetes, 3C, type 3C diabetes. This is the origin from the pancreatogenous or pancreatogenic cause. This is also under the research process. So we didn't get full picture, or in discussion they are not discussed about this in elaborately. So another two type also we can remember in here. But type 2, this type 2 is non-insulin dependent. This is our topic today. So non-insulin dependent, so we can, if we can try, then we have to change our lifestyle and we can manage it. How? During the corona situation, the corona leads the all employees and every human races inside the home, inside the room, and getting the job or like that within sitting on the computer or like that. So movement of our body become restricted during the corona period, and getting fat and fat and fat. This fat, overweight, will leads to diabetes mellitus type 2. We have to measure the BMI, body mass index. This should not be more than 25 kg by meter square. How we should measure it? Our weight divided in kg, our weight divided by kg, and divide our weight in kg divided by height in meter square. So normally it is from 18 to 25 kg per meter square, but if it is increased from 25 to 30, it will be overweight. If more than 30, then it will be obesity. So we should avoid obesity. For this reason, we have a rules 5 in 15. If we work 1 hour by sitting, we must take 5 minutes exercise, 5 to 15 minute exercise, or walking, or vigorous exercise, or movement of the body. We must do. Except this overweight, this overweight will be one of the cause of diabetes type 2. Also the food. We are taking several foods like fried food, butter, cream, starchy things, saturated fat containing food, high salted, high sugar beverage. We should avoid all these things. Otherwise it will create some problem. Leads to diabetes type 2, and also some yoga and meditation. After this, let us take the one view in my PPT. Orko, please share my PPT. Orko, yes, sir. whatever I told you about this diabetes type 1, that is the insulin dependent, and number 2 is the type 2 is the insulin independent diabetes. You just see the RBCs, that hypoglycemia, where I told already that 80 to 100 is our normal glucose level, but now it is American Diabetic Association is told that it is from 70 to 100. So glucose level in our body, if it is below the 70 milligram per dl, then it will, how looks it, you can see that this is my hypoglycemic, that is hypoglycemic RBC. You are seeing this. This is the normal RBC, and this is the glycemic RBC, hyperglycemic RBC. So the symptoms, sign and symptoms, we all know about this: polyphagia, polydipsia, polyuria, like that. In case of it is leads to that fat mobilized into the fatty acid glycerol, and the free fatty acid combined with the acetyl coenzyme A leads to the ketoacidosis. We'll get the acute complication, and in prolonged complication we'll get the cardiovascular, as the sodium and magnesium and others minerals are excreted through the urine during the excretion of the glucose. This will leads to the cardiovascular disease, stroke, chronic kidney disorder, as the osmolality of the Bowman capsule of the kidney will increases, and it will excrete our minerals as well as the glucose. Foot ulcer is very common in case of diabetes because of the nervous damage, eye damage, and different type of cognitive impairment. We have to get the experiences. I already told you the HbA1c, that you all know. As per the age verification, also there are several type of blood all over the world. This is the statistics I am giving here. You are seeing this. All these are into the 2070, but nowadays all these are changed and become higher and higher. Now statistics has been changed. The pathophysiology, especially in case of diabetic type 1, the immune mediated or genetic inheritance, some idiopathic cause is there. Why the insulin is not secreted from the beta cells of the pancreas? The cause is here. This is the immune mediated or genetic inheritance, or idiopathic may be the cause. In case of diabetic type 2, which is our topic today, if we can change, if we can change our lifestyle, because of corona we have to sitting hours to hours in the chair, and body movement is less, like that it is the causing the obesity and overweight. Some genetic aberration, lack of physical activity, poor diet, stress, each and everything leads to the diabetic type 2. Normally the diet, normally our glucose level is like that. You are seeing the photo beside this. This is the pathophysiology, what I told you about the Krebs cycle and mechanism of the glucose metabolism. In details I told about this pathophysiology, how insulin is working in presence of oxygen and mobilize the glucose level, enter into the Krebs cycle and release the ATP in case of normal, and in absence of the insulin, this normal situation is not working properly. So in case of prevention diabetic type 2, we can get rid of it also, maintaining the normal weight, as I told you, the BMI, some physical activity we needs, eating healthy diet, unsaturated fatty food. We have to avoid the saturated fatty food, high salted, high sugar beverage, juice, soda, fried food, etc. Consume less red meat and saturated fat. Cease smoking leads to every lifestyle. In case of lifestyle, we have to, uh, okay, Orko. Uh, Now, some yoga in Ayush department, they include some yoga and pranayam also. So, if we want to get rid of from the diabetic type 2, we should change our food habit. We should give some time for yoga and meditation. Few yoga, I told you, Dr. Rupak is there. He knows the yoga. Although I'm telling some name of the yoga, that is the Janu Sirasana. As our pancreas is at the abdominal side, and we have to passively press this pancreas to um, liberate the insulin. So, in case of we Janu Sirasana we can do, which is compress our abdomen. Paschimottasana, Jog Mudra, Sarvangasana, Halasana, Bhujangasana, Surya Namaskar. So many yogasana are there by which we can get rid of from the diabetics type 2. Also food habit and the slides. Okay, yeah. Orko, you can off my PPT. Orko. Now we have to conscious about this matter. So one thing is there. We already told about the diabetes in total of world, but diabetic country is there. We have to know the diabetic free country also in our world. In Oceania, there is a country named Marshall Island, present between the Philippines and Hawaii Island, which was in 1947 under the America, but since 1983 it get freedom and it is free from diabetes since last 60 years. So we will get at least one country which is diabetic free, and not only that, less diabetic country is also there, that is Eritrea, Somalia, Guinea, Bissau, all have less amount of patient in their country. So not only the diabetic country, diabetic less country is also present in our world. So if you have any question about this matter, you can ask me or up to this. Okay, thank you. Lead to life. Orko, Dr. Bidyut is there? Yes, Dr. Ashok is there. Can you hear me, Dr. Ashok?
Yeah, I can hear now.
Okay.
So, Dr. Rai, could you hear the session?
Yes. Now I can hear.
So,
Okay.
kindly please
So,
moderate the session and add your experiences.
Uh, uh, thank you, Dr.
Dr.
Lakshmi
Rai.
Gandhi. Very nicely you presented this. You had told about the diabetes, important types of diabetes, and why we are so serious to prevent it. As we know that prevention is better than cure. So
Yes.
prevention is, hello,
Yes, yes, we
prevention
can
is
hear.
prevention is very important. And very nicely you mentioned that what changes we shall do if we are to create awareness. To create awareness, it is very much necessary because nowadays it is very rapidly increasing diabetes mellitus patients. And if we change our lifestyle, what you mentioned that if we change our lifestyle, then we can manage it without medication, and latter part if there is necessary to medicine, that we can give that. And in that lifestyle, that avoid all these things, all these food what you mentioned already, and especially physical activity is very important. This physical activity, walking, running, swimming,
Exercise. Mm.
exercise, asans, these are very important. And one important thing you mentioned that if you are working from home, or your work is sitting, or you are in sedentary habit, whatever it may be, then remember that after every 1 hour, you should do some exercise, especially 5 to 15 minutes. This is very important, and this is new thing for me too. That I also could not know that after how much time we can do all these things. And another thing is diet. Diet is very important. Use fiber diet. Avoid fat food, especially saturated fat. Lose extra weight, because this 7% decrease in weight, 7% decrease in weight can keep the diabetes away from us about 60%. So whatever the weight you have, if you are overweight, you realizes that body mass index already she told that, then you can try to remember that if you minimize 7% of body weight, then you can keep the diabetes mellitus about 60% away from you. So overweight, remember always. And another thing, just I am adding it, that if you really, being a physician, if you really want to prevent, or being a patient, if you want to prevent, then remember three things. One is primary prevention, another one is secondary prevention, and third one is tertiary prevention. Primary prevention is that if your family history have this type of diabetes mellitus, then you can start from early age this diabetic screening always. Whether you are diabetic or not, forget that. If family history is there, then always do this screening and follow these things, that regular exercise, fat food, saturated food, red meat, all these things avoid, and do exercises, yoga and other exercises, whether running, swimming, which suits to you, you can do that. And secondary one is that early detection. Early detection is very important. If in secondary stage, early detection is very, if early detection is done, then you can do all these things very seriously. And tertiary, that we already know that heart, kidney, liver, eyes, all these organs are affected. So if any, already if any damage is there, then we can try to check this. Thank you, Dr. Gandhi, once again. Thanks for such nice speech, and thanks to our Dr. Kalyani. thanks to Dr. Bidyut Mukherjee, thanks to Dr. Orko also, that they arranged very nicely. Thank you. If anyone have any question, he can ask. Probably everyone is busy in cricket, so cricket match is also there. So we can finish it.
Okay, I think Bidyut has become
And this
busy.
is common topic.
So anyway,
And each and
definitely,
every person is know about this diabetes mellitus type 2.
definitely.
Very common topic.
Many,
Very
many thanks on behalf
Everyone
of the
knows this
association
very
and
common topic. That's why there is no question.
no question.
If
That is
if a
right.
speaker wants to question, then he must say some controversial point. Then question will become.
right.
Arise.
Otherwise, without controversy, there is no question.
Exactly. Exactly.
Yes, yes.
Anyway, instead of Dr. Mukherjee, I like to conclude the session. Many, many thanks. Many thanks to Madam Lakshmi Gandhi, our
Thank
beloved Professor Dr. Ashok Rai. Bidyut, please. Bidyut has joined.
Uh, Sorry, we are facing a lot of technical snag. In spite of having three networks in our place, still we are facing technical snag. And we thank Lakshmi Madam to be present in a very short notice. And we like to thank Dr. Rupak and Professor Ashok Rai to be present on a very short notice. And it's our program. So we request all to be here uh, on your own will. It happens like nowadays we have to request. And another appeal to all the alumnus across the globe that NIH Alumni Association is running a benevolent fund for the uh, alumnus who are in need in case of emergencies or in some untoward incidents. So please donate whatever you can. The bank details are given in the description of this CME as well as in the other groups. Spread the voice and spread the message of the Alumni Association if we cannot add them in our Telegram and or WhatsApp groups. So we are trying to connect across the globe. We had been able to connect in Canada, in US, apart from our own country, India, Bangladesh, Nepal, Sri Lanka, and also we'll be having now we are having one alumnus in Singapore. So NIH is having alumnus across the globe. So we are trying to connect each and everyone. And very shortly, we are also planning to meet together in NIH. The dates and other things will be declared once it has been finalized. I'll request our beloved President, sir, to appeal to the fraternity to come forward and be a speaker and contribute for our Saturday Audi e-journal. Over to you, Kalyani, sir.
Thank you, Dr. Bidyut Mukherjee, our beloved General Secretary, to our brilliant speaker of the day, Lakshmi Gandhi. Excellent moderation by Professor Ashok Rai and fantastic inauguration by our inaugurator.
Rupak, Dr. Rupak.
Rupak Biswas, he has given us that he is preparing to present before us effect of yogas in a disease. We will be waiting for him. Many, many thanks. And equally thanks to all the viewers, those who will be viewing later on. The simple thing I want to add what we have learned from our teachers regarding these sort of fatal diseases. First thing is I just remember one speech of Dr. S.C. Day, Professor S.C. Day. He used to come in NIT Department of Medicine as our consultant of the institute. He used to tell that uh, we are educated fools. We purchase comfort at the cost of tension and sickness. With the day I am growing or increasing my ages, I am realizing this was a fantastic language of Professor Day, that we are always purchasing and purchasing comfort and at the cost of our tension and sickness. Diabetes is one of them. We practically, indirectly purchase from outside. Except few exceptions, most of the diabetic cases, if you take the history, you see he has purchased either ignorantly or due to excess finance or due to greediness or due to some other reasons. We forget, even when educated, that the universe, whole universe, everyone is on motion. Nothing is static in the world. Starting from the electron, proton, neutron, positron, if we start, we will see everyone is moving and moving non-stop. If we start human life from the zygote formation, before that, and seeing the zygote formation, cytoplasm, mitochondria, cells, tissue, organs, everyone is working with little rest but continuous work. None of our organs, not even a single cell, takes long rest or undue rest. They are very proportionate regarding their health. They are very proportionate and disciplined regarding their intake and outputs, but we are not. That is why Professor used to tell that we are educated fools. We do not concentrate on the basics. This diabetes is a disease which practically we invite by our excess demands. This, as Madam was telling, that excess demand of rest, negligence of activities, excess of medicines, reactive medicines, excess of diets, all excess which is not at all required for the body, we are consuming or entertaining or enjoying, and gradually, we are making our system weak, susceptible. Organs are inhibiting, they are failing to prevent the diseases, and gradually important organs like pancreas, then kidney, as you have heard from Madam speak, that most of the important organs are gradually becoming damaged, ultimately proceeding towards fatality. So that's why everyone must have to be very cautious regarding the normal basic physiology. Plant does not take much food beyond their necessities. Animal doesn't take much more than their necessities. Even a little ant, do not take excess. They keep it for others. They preserve for future. They don't take much. That's why those animals, plants, herbs, all of them, rarely they get obese. They get lethargy. They suffer like diabetes, like serious disease, fatal disease, which damages one after another very important organ and ultimately kills. So every one of us should come to adapt this attitude that we should avoid excess of food, drugs, rest, comforts, and we must help the physiology which is non-stop. That we take sleep to keep your activities fresh and fine. A little rest is necessary. Even heart takes few seconds of rest. That is rest is necessary, but not beyond that. Always one must be on action, active phase, because physiological organs, systems, they are working, and they want that working activities. If they are kept idle, they will be gradually sick. This is the mystery of the human body. So anyway, this is a special problem for professionals like us also, those who are used to sit for a long period in hospital or clinics. We must be very cautious, as Madam told us, that we will continue our practice and observing patients, but we should never neglect the compensatory exercise by which all my activities, all my organs, all my system will be physiologically normal as much as possible. So anyway, again I want to remember the speech I am repeating, that we should be very intellectual, we should be properly educated to keep ourselves fit, by simply doing the normal activities, exercises, walking, swimming, whatever is comfortable for us. And that will be regular, non-stop like our cells, organs, and other tissues. So anyway, one more thing I want to add that by homeopathic system of medicine, we have observed, we are having the documents that type 2 diabetes can also be kept under control for a longer period along with diet controlling or exercise, etc. by simply homeopathy, by homeopathy and allopathy simultaneously, we have observed and we are having records. So the patient will come to us if the case is not very much fatal or the case is not that much serious. We must take the risk of taking trials for at least few months to observe whether homeopathy itself alone can control the diabetes situation or can bring down. We are having the report in a night outpatient department, and we had a project for a long period on diabetes, that diabetes can be simply controlled. Few cases can be completely cured, type 2 diabetes by homeopathy medicines. That is
Yes.
also strictly by conventional medicine, except some acute emergencies. So anyway, like all other common serious, refusable, so-called incurable diseases, homeopathy are equally competent to control, to cure for few cases, and to give a better living life to any patient and every patient. Thank you very much. It is our request to all the alumni, all, that please come forward by your experiences, your knowledges, because we should accept everyone that due to long gap of our classes in our classrooms, we are away from many subjects, we are forgetting. The diabetes in a very detailed form, we did not have in our mind, but Madam makes it clear. Recapitulation, fantastic recapitulation of diabetes, the entire disease. This sort of literal, research, clinical, all sort of experiences help all of us to grow personally and conjointly. Thank you very much. Thank you, Bidyut. Please.
Thank
Thank you, sir. And thanks to all. By this, we are returning to our backstage editor. Before that, our next CME will be on 24th of September, that is 4th Sunday. We are having regular CMEs on 2nd and 4th Sunday. Back to Orko Mukherjee. Over to you, Orko.
Thank
Orko,
the
just a
network.
minute. Now, please stay back. We'll be having a. Acha, Orko had left the session. Okay. By this, we are ending the session tonight. And the panelists, please stay back. We'll have a backstage discussion.
Okay. Thank you and
Thank
good
you
night
very
to
much.